I hope I spend as much time also trying to understand, what does this business do? What can it actually pull off? What's going to work for it? And how do we bring those two things together in a way that is mutually beneficial for both sides? I think of design basically at the end of the day as complex problem solving, right? Like if you strip it all the way down to the bare bones, that's what design is. It is complex problem solving, right? Coming up with some sort of solution or new thing that fixes for something or that invents something.
Hi everyone, welcome to Decentralized, where we interview the most forward-thinking and innovative creators on the planet to inspire and help you to reach your full creative potential. In the episode, I chat with Lindsey Mosby, partner at Profit, an innovation and growth agency, and she's currently based in Austin. In the past, she made many outstanding experiences. For example, she worked as the head of strategic design at Philips and also as a VP of strategy and health at Frog. In the episode, we focus on how to design and develop better healthcare experiences, both digitally but also physically, looking at the whole customer journey, but also looking into opportunities, how to create innovations when it comes to the power of cross-industry learnings. So for example, what can we learn from the hospitality industry? What can we learn, for example, from the finance industry in order to create better healthcare experiences? So I hope you enjoyed the episode. All right, so I'm here with Lindsey Mosby. Thank you so much for taking the time.
Thank you. It's wonderful to be here.
So you are working as a partner at Profit, focusing on experience innovation, specifically on the healthcare industry, which is going to be the primary focus also on our conversation. You have a lot of experience when it comes to the healthcare industry, so I'm looking forward to learn about that. We had to think like a really interesting initial discussion, I think, on some of the similarities and some of the growth opportunities for designers getting engaged in that industry. And specifically now also everything happening in the last 2.5 years, of course, has been influencing that tremendously. So yeah, we're looking forward to that. But I think for the very beginning, I think it would be really great for the audience if you tell maybe a little bit about your story. How did it all start out for you? You worked in different countries, different locations, and different industries as well. So I think it's kind of interesting maybe to go a little bit toward your journey and how you now focusing on how it all ended up basically now at this moment, focusing specifically on the healthcare industry.
Yeah, so let's see. Well, I guess first things first, I do not have family in the healthcare industry. Well, I have family in dentistry, but not sort of in the hardcore medical, no surgeons, no scientists or anything like that in my background. However, I will say, I always tell people that I'm the child of two total hippies. And so there was a whole lot of give back in my family. There was a lot of, the more you know, the more you owe, was a saying I always heard from my mom. And my mother was a teacher. My father was in government. And I think I internalized really early on that, if you're going to spend the better part of your days working really hard at something, sure would be great if you can have that something be meaningful and purposeful and that, add something good back into the world. So I've always sort of had a predisposition to jobs of service, which I think healthcare is very much an industry where we are trying to be of service to people. I got interested in design really early on, I guess, in my graduate career. I have a master's in science from the Georgia Institute of Technology and information design and technology. And it was kind of at that time when, I'll show my age here, the internet was really coming along and people were like, "Ooh, this is going to be a thing." And the degree was, a lot of deep learning on communication and how does technology change the way that people connect with each other? How does it change the way people behave? What's it going to mean when instead of sending letters, we are, getting messages in nanoseconds across the planet? That became an absolutely fascinating place for those of us who consider ourselves designers. Obviously, what is it? That's all about behavior. That's all about meaning. That's all about exchange. And so, yeah, it was a fascinating time to sort of come of age in my own career. I guess, a few years after that, I had the opportunity to do some work with Philips, actually, very, very early on. And with their healthcare division. And that's sort of when the worlds of design and strategy collided with healthcare. guess that was probably in, 2002, 2003. And then I've just sort of never looked back. Yeah, you point out I worked at Stone Yamashita Partners. I've worked at Sapient. I worked at Philips for a long time. I really cut my teeth at Frog design. So I was about an 8-year tenure there building the healthcare practice within the design firm. So that's probably where I get my formative of years. And now really, really lucky and loving being at Profit, where I really have the opportunity to sort of do the same thing. How do we bring, again, design and strategy to an industry that is, I would argue, in as much, if not more, need for that kind of thinking and those kinds of solutions than any other industry out there. If there's ever an industry that needs, human-centered design, it's definitely healthcare.
For sure. If you think back, maybe you have been doing so many projects in that context, right? Also healthcare, like you said. But there was a particular project where you noticed the difference that you can make as a designer being involved in a project, or something that just stood out to you, maybe one of your past projects where you're like, hey, we can really create an impact here if we're focusing on a customer experience, do it user-centered, like you are saying. Some kind of particular project stood out to you that kind of tells that story most strongly for you?
I mean, there's a lot. And I think, one of the things that that has been the most rewarding for me in my career has been the opportunity to bring what I hope is deeply strategic tools and resources to a problem or a challenge that's being explored, but in a way that is absolutely inclusive of the human beings that you're designing that for, right? So much of my work usually includes a design research phase at the beginning of it. And by design research for me, I mean, sort of ethnographically based contextual inquiry, where you are literally going into people's homes or into a doctor's office or into the surgical theater, into clinics, and you're really, you're getting that firsthand understanding of what are these people's lives like? What are they going through? And I've done that, across provider systems, hospitals, insurers, pharmaceuticals, consumer health, all that sort of stuff. But if I had to say one, at least that's pretty recent, it's a couple of years ago, but that just mattered a lot to me. I had the opportunity to work with the University of Texas, the Design Institute for Health, which is a relatively new program, also, and the Austin Housing Authority, HACA, and a very large construction organization on redesigning and helping them sort of rebuild one of the United States' very first housing projects. So, back in the day when housing projects became a government thing, 3 of them were started in Austin. And I had the opportunity to be a part of a program or a part of a team that was asked to go and speak with the residents, go and speak with people that live in this project about, they're going to basically tear this whole thing down and build something new. And you have the opportunity to influence and inform what a new health and wellness service, and facility might look like here at Chalmers. Chalmers Court is the name of the project. And, there's nothing like walking into situations that are very, very different from your own to both tell you how blessed and how fortunate you are, but also how incredibly similar we all are as people, no matter how much money we have or don't have, what color you are, what school you went to, all that sort of stuff. Walking into these people's homes and having a chance to sit down and talk, it was incredibly enlightening. And I felt really, again, honored to have them sit and tell me these very real stories about this is what it's like to be in my shoes. This is what it's like to have to, worry about whether there's food on the table every night, to worry about whether my transportation is going to be, am I going to be able to get my kid to daycare? Am I going to be able to get to that doctor's appointment? How am I going to take off work because my kid is sick when I'm going to get fired because it's a day job and I don't have, the blessing, or I don't have the luxury of a salaried position. We make it really hard. We make it really, really hard for people to take good care of themselves when they're kind of behind the eight ball. So, the work was to do that investigation and then make recommendations to the organizations that were doing the big build on, here's what people want. You think they want A, B, and C, but we went and asked, and what they really want is better access to really good food. They want support and help on knowing how to manage finances. They need, better upfront daycare. To be able to make a difference there, just, that just resonates in a way that is different from some of the other work that I've done, right? And I have to, as a consultant, you have to, at the end of the day, sit back and hope, please let them, let these organizations do it, right? Don't just talk about it. Don't just ask these people what they want, but actually build it so that they have what they need. But it's coming, it's happening, I'm seeing articles about it and stuff. So it's really rewarding.
100%. And maybe for the audience, for context, you just told me before the recording, basically, you have been on a trip, basically, with different locations where you have been doing a lot of user research. So also in your work, you're focusing a lot on the user research part.
Yes.
I totally agree, right? It's a power of bringing in user research to these assumptions that people try to make about major business decisions in benefit of the customer they have never speaking to, right? So and kind of changing that and bringing this to the table, I think is critical for people to understand. And as a designer, of course, highly rewarding. And I think the great thing is that you learn. It's like as a designer, you constantly learn, specifically in your environment. You every day you're picking up new stories and new insights, and so I think that's great. And I think for the audience, what would be maybe interesting, not so sure if I ever asked this in the podcast, but because I think it's kind of interesting what you said, that you focus on the user research part, and then you're hoping that it's gonna get implemented. This is always a struggle for people working very early on, like you do, strategic design, right, and so on. And I've been discussing this with other guests in the episode, what can you do to make sure this gets then executed, right? And a couple of principles about that. But I would love to hear your basic perspective on it. Specifically now in the healthcare industry, you're dealing with high complexity when it comes to different stakeholders. You have the user, you
regulation,
have the different parts and so on. So what are your strategies to make sure the innovation is not dying at the drawing board and basically it get executed later on? Any kind of learnings there?
So, okay, there's a couple of things. I'm going to try and remember them all. So first things first, I really try to come to any program that I'm on, anything that I'm doing with a client partner, as both a human, a human-centered design challenge to solve and a business-centered design challenge to solve. Those two things have to live simultaneously, right? So if you ever want to get a solution implemented, there has to be exchanged value on both of those sides, right? It has to work for the user and it has to work for the business. So in as much as, I'm all about getting into the heads and hearts of the people that we're designing for, I hope I spend as much time also trying to understand, what does this business do? What can it actually pull off? What's going to work for it? And how do we bring those two things together in a way that is mutually beneficial for both sides? I think of design basically at the end of the day as complex problem solving, right? If you strip it all the way down to the bare bones, that's what design is. It is complex problem solving, right? Coming up with some sort of solution or new thing that fixes for something or that invents something. Mm-hmm. So there's a lot of work on, understanding your user, but also understanding the business and bringing that rigor. When you do that, the business feels, and I'll say that sort of, personalize it, the business feels heard, right? They feel like, okay, you're trying to help me design something that I can actually implement from a business standpoint and still be a business, right? Make money, lower costs, whatever their objectives are. So I think historically maybe design has had a stereotype of being pie in the sky, and that we do things, we come up with these great ideas, but none of them are actually business worthy. I think that's changing. Maybe we had that reputation for a reason at one point, but I don't see good design in that space at all now. I think good design is very much in the business of making, creating solutions that work for both sides of the equation. So there's that. In healthcare, I think, one of the things that I talk a lot about with my clients is they have a tendency to be like, oh, we can't do this. This is too hard. We don't have this, that, or whatever, all the excuses for not being able to do something. And in healthcare, I love to remind them, we are one of the most innovative and, practical magic inducing industries out there. Healthcare is nuts when it comes to innovation, right? We take organs out of people's bodies and put them back in, right? We see into the minutia of the cell and create new drugs that cure pandemics most recently, right? Not cure it, but make it better than it was anyway. Yeah. So don't forget your ethos, right? Don't forget where healthcare comes from, right? The genesis of that is all about design and complex problem solving. Just because your administrivia is complicated and your IT systems don't work, that is not a good excuse for not figuring out how to do it, right? So I use a lot of carrot and stick with my clients, right? The carrot being, you've asked us to come in and help you solve something. You're trying to do the right thing. That's great. The stick is, do not go ask people what they want and what they need, especially people who are deeply in need or who are hurting, who are sick, who are dying, who are caring for people who are dying. Don't go ask them what they need and then not do anything about it when we come back and tell you, here's what you could do, because you think it's hard or because you think it's expensive. We can't do that to people. We just can't do that. That's the most heartbreaking part for me, right? So the more that I can convince a client that, even if you can't do everything, even if you can't change the whole world, what little thing can we begin to put in place? What pilots can you do? What small incremental change can you make that just helps take some of the burden off, that takes some of the friction out of what, at least in the United States, is an incredibly complex and incredibly frustrating system for people. The other thing that I will say that I think is that as designers, we have the opportunity not only to do, but we also need to take credit for or feel good about maybe, is even when our clients don't go out and make the perfect product or service at the end of the day, usually by virtue of what we've done, right? The work that we have done with that organization, taking them into the field with us, I love doing that. I want my clients to come into the research process with me and sit in these people's homes. I want them to come to our concepting sessions. I want them to do synthesis with us. I want them to embed in our teams. Because, again, it makes it more probable that they're going to actually follow through with the thing that we've done. But even if they don't, we have then helped shape the way that organization works and thinks, right? So you got to kind of include... They
learn the process, right? They they understand that as well. Yeah, there's another way of doing it. Yeah.
Yep. They understand, and are they designers? No, they didn't, they're not as steeped in it as we are. They didn't go to school for it, but they are learning the tools and they are able to start listening for the hallmarks, right? They know they begin to understand and incorporate that into their own ways of working. That's organizational change, right? And that counts. That does count. It's not quite as fun as seeing your product hit the shelves, but it is a very real piece of the work that I think design can do. It's the long haul work that we do, but it is bringing that back into the organizations that we work in, and offering up some of the tools that we know work and that we know affect things differently, and giving our clients and their employees and their partners ways to use those tools as well.
Yeah, and 100%. I think a couple of points to kind of take it forward from here. I think one of the things that you have mentioned is super interesting, that you try to make this an open process, right? And I think that's also what I learned, is that well, if you work with these internal stakeholders and on other departments, they may not have the time to contribute, go to all of the research sessions. You don't ask them to do that, but like you always keep it open, and you basically always say like, yeah, maybe you join for 1 or 2, and
Just
maybe you,
yeah,
and you forward these meetings and kind of make the insights transparent. You don't try to work in a vacuum. So it doesn't look like you're hiding something, because I think like one of the problems also sometimes that can happen in a company is that you have an outcome that is not in the preference of maybe some of these people that you work with. And you kind of have to tell them about like something they don't like to hear.
Yeah.
And so you want to make this very open process, because that creates trust in you that you're not inventing stuff here. No, this is what people are saying, right? Because that's another problem, like the trust in the results and the urgentness of doing something about it, right? And the validation that has been happening in that process. Any kind of learnings from you to kind of manifest this even more, or make this even more strong, that how, like maybe for the user research folks listening, basically, how do you basically make your research process in a way that the people are going to believe it more? Because I saw also what I seeing a lot is like, presentations of that have been happening, but then they're missing the concrete actions afterwards, or it doesn't come to the surface so much. Any kind of learnings there that people really get the need and having the trust in these learnings, and not saying, yeah, it's just like a few people saying it. Like, like it's just a quantitative, right?
Right.
So how do you do that?
No, I can use the program that I'm on right now. We're working with an organization that's focused on women's health. They're a provider focused on women's health. And our team did this very thing. We had 24 2-hour-long in-home interviews with 24 different women in this particular part of the United States. And we absolutely invited our clients in. And one of the core stakeholders, one of the key executives on the client side, she on purpose chose she could only do 2 because she's busy, right? But she chose 2 interviews that she knew were going to be with people that were, living in really sort of very, very strapped financial situations.
Giving her a new perspective, right?
Yeah, because she knew she wanted to see something different, right? She wanted to kind of like make sure that it was something that was going to really resonate. And she told her entire team in one of our workshops, she was like, I would never have, I can't remember her exact words, but essentially she was like, I saw things that I've never seen because I'm sitting behind my desk. She said, I get this in a way that I didn't get this before. That right there is a win, right? If you get them out there in the field because they do feel it and see it differently. If you can't do that, make sure when you are doing this work that you are, and of course you have to have, permission, but take pictures of the people that you're interviewing, take snapshots of their home, get their voice in audio, make sure that you have that media that you can then bring to the presentation for everybody that wasn't there. They need to hear those voices. I've sat in the middle of a Whataburger in Austin, Texas, with a gentleman who was talking about his father who has Huntington's disease, which is one of the worst diseases ever. He broke down and cried in a restaurant, talking about how difficult this disease is and how it has affected his family. I needed for my clients to hear that. They need to hear him
from that person
sobbing. So you got to bring those video clips in. You've got to bring those audio clips in and let them hear it and let them really resonate with it. Then the flip side is you have to work just as hard as a designer on the client side to say, let's talk about what your business is capable of. What can you actually do? Let's get in there and start thinking about what's the business model for this going to be? Are you set up to be able to do this? All of pharma wants to be in digital health. Okay, great. You don't have anybody in your business that knows what digital is. You guys make drugs for a living, right? So help them understand the organizational impact of their desire to get out there and do something really good. But desire to do something really good and the ability to actually pull it off are 2 very different things. So as exhausting as it is and rewarding as it is to work with the actual humans that you're designing for, working with those businesses and making sure that they feel invested in the solution and that they have the tools that they need to do it and that we're there to help them figure those tools out, or bring them partnerships when they don't have that. That's a huge piece of it. That's an absolutely huge piece of it. And it'll leave you absolutely wiped out at the end. But it's the work that has to get done, right? Like that's the work that has to get done. You can't just come back and say, here's, you asked what people need, here it is, we're out. You got to be able to be in there and also to, keep them engaged.
100%. And I think that there's some good takeaways here. Like, I can recommend it for sure. Like what you said, like video elements, like how can you tell the story about it, and not make it just about the numbers, right? And yeah, I think this is powerful. Another thing, of course, like you said before, is like, healthcare is packed with innovation and scientific breakthroughs, and like designers can really help to roll this out and make this more accessible to innovation, right? And I just was thinking about the COVID test. Actually, one of the most used healthcare, let's say, innovation, if you want to say, like in the basically, at least like in terms of like how many people are using it from the scale perspective.
Everybody's all of a sudden we're all diagnosticians.
And at the same time, it's, if you think about just the COVID test itself, like how bad it is actually designed. Like, if we're looking at the C and the T on top of the thing, like everyone is always Googling, so is it T that is like negative, or is it the C?
I know. Why doesn't it just say yes and no?
Exactly. Exactly. I mean, like, right? Is it done for like hospital people, or like for like people that are expert? Or is it done, should not be designed for people, for everyday people that have no clue what these letters mean?
Correct.
Right?
Yes.
And so I don't need to read something, but I can actually do it. And like, why is there no like simple step graphic that cannot tell me that very simply?
An Apple or an IKEA unpack experience, right? Like you just have a little icon of the little person doing I don't need all the words. I don't need the words. Yeah. Like it needs to be that simple.
Exactly. And so it's kind of fascinating, right? Like, and but we already talked about that a little bit prior to this recording, like what kind of opportunities there are on innovation. You have been also learning from other industries, specifically like you're mentioning finance and also the healthcare, the hospitality industry. So I think that's so two interesting kind of perspectives on the healthcare industry and what are opportunities to innovate. Maybe you can outline this a little bit, your thinking when it comes to that.
Yeah, sure. The two you mentioned are ones that I think are, ripe for the pickings. As they say in the South. It's one thing to be really, really steeped in healthcare, and to, I've been doing this for 20 years-ish or so, and have been focused on this particular industry. That being said, there's rarely a project that I do where my clients are saying, where they're only saying, what are other healthcare players doing? They want to know how everybody else is doing it, right? Those of us in health, we already know that we're not doing it right now. And then we've got a lot to learn from outside of our own backyard. And I have felt for a long time that financial services and hospitality in particular just have so many learnings for healthcare. Financial services for me is probably the easiest one to talk about, because it like healthcare is a highly regulated industry. It is predicated on privacy and data protections, things that are very, very similar to the way healthcare runs, right? Like it's a highly regulated industry. It has, significant privacy issues, data regulation, all that sort of stuff. But I find it stunning that, my bank has figured out how to exchange my bank information with every other bank on the planet, and can get my money from one corner of the United States to Singapore in, a couple of seconds for $2.50 maybe. But that interoperability, that exchange, and that seamlessness of the way financial data works, why is that not like it in healthcare? There's no technological reason that it can't happen. The barriers that we have are, and not that these are not a big deal. Yes, we have to make sure that people's information is kept private. Yes, we have to make sure that accuracy and redundancy of information is clearly incredibly important when you're talking about people's lives, people's well-being. But those are technicalities, right? Like we can do it. We just haven't done it yet. healthcare has a tendency to, and has operated on the premise that patient data is owned by a Cerner or an Epic or a hospital or whomever. Patients don't really even feel like they own their data, right? Like, I don't know if this is the same in other countries, but when you go into your doctor here, well, now it's on a tablet, but it used to be that your manila folder, your file with all of your information would be sitting on the counter waiting. The nurse would have dropped it off and the doctor's going to come in and tell you what's in your file. I remember sitting in that, in those offices or patient rooms and wanting to get up and look at that file and feeling like I wasn't supposed to. It's like, but that's mine.
Yeah.
That's me. Why do I not feel like I can get up and look at that? So there's a lot to change there, right? Like, healthcare thinks they own your data. Financial services think they broker your data. And that is a fundamental
different way of thinking. Yeah.
Different way of thinking. Healthcare needs to start thinking about or accepting that it brokers data, but it does not own data. And I think when we do that, two really important things happen. One, information that should be getting to all the people in the healthcare system, all your other doctors, everybody should be using the same information and have access to it. That's one piece of it, right? So we don't ask people 3 times. People aren't, carrying big boxes of paper to doctor because nobody knows, everything all in one place. Yes, healthcare needs to get to a place where the big companies are understanding that they may broker people's information, but that they don't own people's information. When they do that, and if we can get ourselves to that place, then the interoperability, the seamlessness with which we feel in our banking lives becomes apparent in our healthcare lives, right? Like everybody's working from the same page. The other thing that I think that it does is, if people feel like they own their own data, you have a sense of autonomy and a sense of control that is right, that you should have, right? Like, I shouldn't feel like I'm not allowed to look at my own file. I need to look at my own file because I need to be accountable for my own health. I need to be a participant, yeah. And I need to know that somebody's, knows that I'm supposed to do these things. I love how Uber, there's another sort of industry outside the industry example. I love how Uber is predicated on the notion that you can rate your driver and your driver can rate you. I would love to see us get to that point in healthcare. I would love for us to get to a place where not only can I rate my doctor and say they're a good doctor and he or she has really great bedside manner and all of that. I think that doctors should also be able to say you're a great patient or you're not, right? Like, and again, there's lots of things that are behind that and people's access and bias, and there's a lot to unpack in that. But if you can imagine a scenario where a doctor and a patient felt like they were on the same page and that they were in this thing together, that's a very different relationship than now. It's actually part of what is going to make value-based care work in the United States, right? So value-based care is predicated on keeping people well for longer, as opposed to just fixing you when you're sick. But that means that both parties have to be able to hold each other accountable, right? So a doctor can't be in the position of getting dinged and not getting paid when they've got patients that aren't doing what they've told them to do, right? When they've given them a protocol or a treatment plan and they're not doing it. That's not fair. So I want us to, again, whether it's financial services and that fluidity, safe, secure fluidity of data exchange, or the way that we actually engage as partners in a business, right? In a healthcare business, to, hospitality is the other one. How do we put much more of a, hospitals need to be trying to attract people to them. There needs to be that competition where a patient, or a person is able to say, I'm going to go over here because it's better over there. Mm-hmm, this is a better situation. I like this better. My money, I know what I'm getting for my money over here, as opposed to you just have to, go wherever you're sent. Moving from a B2B to a B2C model is also, the work of healthcare in the continued work of healthcare. We've been doing it for a long time and not moving nearly fast enough.
I think it's interesting what you are mentioning, that with the experience of the doctor as well. Like if I have to think about innovation of in the hackerspace, I would primarily, my first thing would come to my mind is the customer, meaning like the patient experience,
Yeah.
right? Because
Yeah.
maybe we are more in the shoes of that, and we know about how much struggling that is. But but you're pointing out something also about the doctor experience being not optimal, of course. And there's like that is, I don't think like people really focus on that much. Even though maybe from a B2B relationship, even from a business perspective, there might be a lot more to maybe and more upside, even more upside maybe for the businesses investing in there. But and that's interesting. And the other one that you were mentioning is that the data transfer, right? Yeah, that's totally true. I mean, if like I was recently moving, so I have a new doctor now. That doctor doesn't has any of my previous data, like, right? So it's gone, right? So of course, like I have it, I can basically get it, but it's not as seamless as switching a bank account, right? I can just like, get all my history to someone else, right? Yeah. The other thing is that I think it's kind of interesting with, on the same time, there is, of course, telemedicine growing, right? So basically we are more and more connected. I saw a statistic recently how it is during COVID really has been picking up, specifically in the US, where I think in terms of the way the services are working, more private companies, and maybe in Germany it's maybe as a comparison maybe even more difficult, and maybe even more regulations that make some of these things in terms of data even more difficult. But this has been really picking up. I think like one of the problems to solve is going to be also how do you maintain that on the one side you want to have that seamless access and a quick feedback and maybe anonymous kind of relationship. At the same time, it is still kind of beneficial to know a face and he knows you best, right? And that's a dimension that it's get lost in the telemedicine, get lost a little bit in the telemedicine space, because it's more about, okay, I want to have feedback in 15 minutes, 30 minutes, and so on, right? And I think that's kind of interesting that there is this quick and more like data-driven approach, but then there's still a lot of value in the personal relationship to the expert.
So I at Profit, we've been talking a lot about what are the kind of core things that we see driving innovation in healthcare in particular. And I think, things like the continued rise of the connected and sort of empowered consumer, right? Consumer/patient. That's a huge thing, right? Like we're all wearing well, not all of us, but we're wearing Apple Watches. We've got smartphones. We have, we all, there's a lot more at consumers' fingertips. I can Dr. Google anything, right? The expansion of care, which is what you're talking about here, right? It's not just in hospitals. It's not just in clinics. We're bringing care everywhere, to homes, to, on the go. There's mobile units that are going into neighborhoods and actually doing care there, taking care to where it's needed. This shift to value-based care from a fee-for-service, at least in the US, that has to happen. We all know it. It's just taking forever because people are still making a whole lot of money on fee-for-service. And then last but not least, and I think something that sort of underpins all of these is that decentralization of data, that democratization of data. Those four things are, among others, but in particular, those four, I think are going to have an outsized impact on the healthcare industry moving forward. And part of what it is predicated on, to your point, is technology, right? Technology, the fact that we can do telemedicine and that it did get adopted during COVID, and that you could see a doctor, via video chat, is huge. The fact that appointment actually got reimbursed for that doctor on the other side, and they were able to count it as an actual visit, matters, right? Like the fact that technology is able to do these things, and then we are now acknowledging and figuring out how to incorporate it into the business of healthcare is huge, right? It's absolutely fundamental. I think, in the United States, I think telemedicine went from like a 10% use to something crazy like 45%, right? Of people who were like, yeah, I'm totally comfortable using telemedicine for some of these things.
Mm-hmm.
It's not going to replace a doctor. That's not the point, right? It's not going to replace a nurse. But at least in the US, it's some staggering number, like 50% of doctors would not tell their children to go into their profession. That is not good.
Wow. Oh,
that's not
insane.
good because they're not doing what they thought they were going to be doing, right? Like doctors tell story after story after story about like, I only have 7 minutes with that person. I don't, I spend my entire visit with them tapping away on a computer and not looking at their face and not talking to them. Well, okay, so those are fixable things, right? Like how can we use technology to let the in-person time that people have matter and be meaningful? Why are we not using an Alexa, a HIPAA compliant Alexa in a doctor's office so that they're not tapping on a computer? It's just recognizing natural language and transcribing that, back into a file. Will it be perfect? No. Can we get it perfect? Yes, we can. We just haven't done it yet, right? So I do think the doctor and the nurse are as important for design's focus in healthcare as the patient. I absolutely do. Because without them, we're screwed. Right?
It totally makes sense because in the end, like this gonna benefit the customer or the patient as well, right? I mean, it's a 100%. Two-sided relationship. Yeah.
Yep.
The other thing I would like to get on is the hospitality industry that you are mentioning, right? So what can the healthcare industry learn from the hospitality industry in your mind? So
I remember doing a strategy project with this one of my favorite colleagues, Hammonds Stallings, who I worked with at Frog ages ago. We were doing this. We were doing probably a pharmaceutical program. I don't actually even remember exactly what it was, but he did this great sort of deep dive on NPS scores, which is basically a measure of, I don't know if they use that in other countries necessarily, but NPS is basically a measure of would you buy from this company again? So it's a way for companies to kind of get a feel from their consumers, do they like them or not? And he did this great sort of outline of what are average NPS scores across industries. So, telecommunications, your phone, insurance companies, travel, automotive, hospitality, financial services. And the stunning difference between the scores of trust and, do you enjoy working with these companies between like healthcare and telecommunications and insurance versus retail, hospitality, travel, all of that it was staggering, right? Like it was like healthcare gets a 1 and telecommunication gets a 2 and hospitality and retail get 7, 8, 9. Think about the difference between those two things, right? The fundamental difference between those two industries is one is signing you into a contract. It is forcing you into a contract at the beginning of your relationship. So with insurance, with healthcare, I have to be insured and I have to sign on a dotted line and I have to pay X every month. And I don't really know what I'm getting, right? With my phone, I have to sign up for 2 years and I'm trapped into that thing with that company, whatever it is, and they dictate the terms of our engagement. Flip to the other side and you're thinking about hospitality or retail. Their whole gig is to draw me in. They are looking to pull me to them as much as they possibly can. So the feel is and the behavior that those companies exhibit are completely different, right? Hospitality is all about attracting you, right? They want to win you. So they are doing everything they can to take care of you, right? You walk into a hospital, you walk into a hotel lobby, especially the fancy ones. It smells nice. It looks beautiful. You're greeted with, by name. They are immediately trying to make sure that you feel like you're being well taken care of, that they know you. You know what to expect when you go into these rooms. We're not doing that in healthcare. In healthcare, it's sort of like, yeah, well, we've got you, you're ours, so deal with it. Deal with us.
Yeah.
That's B2B and contract based. We need to be much more focused on B2C and attraction based. Healthcare needs to feel like they are working to get me, not that I'm stuck with them.
Yeah. And it's interesting because it's connected how the businesses are set up, like the financial incentives also for hospitals and like doctors and so on, right? So there's been different models. For example, sometimes basically, are they paid by the amount of time people stay? Basically, are they paid per night, or do they have a financial incentive to get people out again, right?
Right.
So
now.
And this is all shaping like how the relationship then really works. So there's a lot of infrastructure change also that can benefit,
absolutely,
or can make customers benefit there. And so interesting. I would love to continue talking to you, but I think we need to wrap it up because of time, Lindsey. So on behalf of the audience, just wrapping up this episode, I would like to thank you so much for the time, and I'm really sure the audience got a lot out of it.
Well, thank you so much. I've really enjoyed it.
All right, that was the episode. Thank you so much for tuning in. If you enjoyed the episode, make sure to give it a thumbs up and let me know in the comments about your thoughts and biggest learnings from the episode. I'm always super curious about that. You can also tag me in a post about your biggest takeaway and share your insights with others to pass on your learnings. If the episode provided you a lot of value, make sure to follow, subscribe, and share it with friends and colleagues so they also have the chance to learn and grow. Until next time, cheers.